Hello, and welcome to this short video. I will review the COVID-19 safety checklist and share some tips on how to make it meaningful for your team. We are now over a year into the pandemic, and staff are doing an excellent job at adapting to the requirement for use of personal protective equipment, or PPE, and setting up the physical environment to keep themselves, their patients, and families safe. Some teams have found the use of this COVID-19 safety checklist to be a very effective way of communicating the environmental strategies and PPE requirements. The checklist helps teams identify where there are barriers and put strategies in place to make it easier to follow the guidelines with the goal of keeping everyone safe. This is a picture of the COVID-19 safety checklist that was developed based on the standard expectations for PPE use and physical environments within HHS. The checklist is divided into two sections. The top section focuses on PPE, including gowns, masks, eye protection, and associated hand hygiene. The lower section addresses how we are supporting safety by setting up the physical environment. Some examples include observing room occupancy limits, whether chairs have been spaced out, whether common spaces are free of clutter, and finally, whether teams are avoiding communal food. To understand why we developed the COVID-19 safety checklist, it can be helpful to think about the Swiss cheese model. Imagine multiple layers of protection, each one a slice of cheese. No one layer is perfect, they all have holes, and when the holes line up, the risk of infection increases. We've already added the layers of protection shown here as distancing, masks, cleaning, and hand washing. Now we're adding observations so we can reduce the number of gaps in each layer of protection, or perhaps more simply, reduce the number of holes in each slice of cheese. Remember, the more safety measures that we layer and the more consistent we are with each of them, the lower the risk of COVID-19 spreading. We all share this responsibility. The COVID-19 safety checklist can help your team ensure that they are using the appropriate layers of protection and doing so in the most effective way to reduce the risk of COVID-19 transmission. This short video will provide guidance on how to use the COVID-19 safety checklist. The steps that we will review are: first, reviewing the guidelines that are available on the hub; second, identifying who will do the checklist; third, completing the observations; fourth, posting and sharing the findings with the team. Once we have the findings from the checklist, we want to celebrate what we're doing well and understand the gaps so we can tackle them as a team. Finally, we want to continue to cycle through completing the observations, celebrating successes, and using problem solving to understand and tackle our gaps. As mentioned earlier, the observations will be focusing on the correct use of PPE and the associated hand hygiene, as well as the physical environment. If there are items on the checklist that do not apply to your area, you may cross them out or edit the form to match your team's needs. In order to complete the checklist, staff will need to be familiar with the guidelines. Detailed reference materials are available on the hub. To get there, you can click the red box, COVID-19 information, then select Clinical Resources, followed by PPE Guidelines. Videos are also available. If there are questions that cannot be answered by accessing the information on the hub, you can reach out to your team's educator or a member of the Infection Prevention and Control team to seek clarification. When it comes to who will do the observations, there is much flexibility. The observer may volunteer, or team members could be assigned. It is ideal to have a number of different staff participate in doing the observations, as this will encourage more staff to review the guidelines, and it will also build shared ownership of the practices. We will now review the steps involved in completing the actual observations. The overarching principle is that staff and patient safety is important, and the checklist is a structured way to support teams to be able to ensure safe practices. When completing the observations, aim to observe 3 staff for each of the items in Part A. This may not be possible in a 15 to 20 minute time frame. Complete what you can in 20 minutes. If any of the 3 staff observed miss a step, mark the item red or with an X. If you are not able to observe the item, it can be marked with NA. Whenever possible, provide kind feedback if there is a gap, saying something like, "I'm doing the COVID-19 safety checklist today and noticed that you did not sanitize your hands prior to putting on your gloves. I know that it can be difficult when we are in a rush, and it is an important step. Do you have any questions?" It can be helpful to orient the team ahead of time that it is an expectation of the observer to make their teammates aware of any gaps from the standard if they're identified. The purpose is not to blame or to point out any one person, but rather to build safe habits across the whole team. Once the checklist is completed, it can be posted and shared with the team. Think about how this can be incorporated into your usual structure, such as huddles or perhaps morning meetings. It is valuable to discuss the findings at least weekly. During the discussion, celebrate what is going well. People are trying really hard and everyone wants to stay safe. Where there are gaps from the standard, discuss them as a team. If there is a clear action, just do it. If the same gap has been identified more than once, try to get to the root cause. Remember, you can reach out to your leaders, educators, or infection prevention and control team members, depending on which support may be needed. I'll now cover a few tips for getting started. The observations can be completed in a 15 to 20 minute block or in smaller increments throughout a shift. When the observations are completed, is up to your team. If you have an overnight model, doing observations on both shifts is recommended. During the first week of observations, observe each item in the checklist daily. If an item is green on a daily basis, meaning there are no gaps from the standard, that item can be moved to weekly observation for the next week. Continue with or move back to daily observations for items with any red on the tracking sheet. If a gap is identified, we want to observe more frequently to understand and address the problem. Where possible, use green and red on the safety checklist to easily observe trends at a glance. Observers can add notes on the back of the sheet to provide more detail about gaps observed. For example, if hand sanitizer was not used prior to donning gloves, this can be noted on the sheet on the back. Please don't include people's names. We're observing the processes, not the people. It's worth saying again, celebrate the team for taking the time to focus on safety. Remember that Swiss cheese model? We want all the appropriate measures, or slices of cheese, in place to prevent transmission, and we want to reduce the number of holes or gaps in each slice of cheese. It's our shared responsibility. Thank you for your commitment to safety. If you or your team have any questions or would like support, please don't hesitate to reach out. Thank you.